What we found was very interesting because the luminal subtype is found about half of the time when we have a tumor we would look at and call HER2 positive by FISH and estrogen receptor positive by IHC. So we'd normally say, well, that's an estrogen receptor positive, HER2 positive tumor. Turned out that only half of those were really HER2 subtype and the other half were luminal subtype. That turns out to be about a third of the patients, and it turns out to be a group that we are really impressed with surprised with the results, because what we found was just fortuitous, really. This study spanned the period of time where at first we were treating everyone with chemotherapy and trastuzumab only. Then pertuzumab was approved and became standard for neoadjuvant treatment of HER2 positive tumors. So we have about half of the patients treated with chemo trastuzumab and about half treated with chemo trastuzumab and pertuzumab. And the most striking finding that we found was in that group of patients who are HER2 positive by FISH, estrogen receptor positive by IHC. Again, half of those patients come out luminal subtype. If you treat them with chemo and Herceptin, which is what we did all along until pertuzumab, if you treat those ER positive, HER2 positive patients with chemo and trastuzumab, they have a very low path CR rate. We thought, well, that's because their biology is not really HER2 biology. That's, targeting HER2 is not going to help in those patients. We were completely wrong about that, because then we noticed this path CR rate in that group of patients creeping up. And when Peter Beich, one of the study investigators, said, well, let's look and see if this is a pertuzumab effect, he was dead on. In other words, the path CR rate with chemo trastuzumab in those patients was 4%, and the path CR rate with chemo trastuzumab and pertuzumab in those patients was 39%, 40%. So just a dramatic impact in those patients with the addition of pertuzumab. So whereas at first we thought, well, maybe it's not going to be helpful to target HER2 in these patients that come out luminal subtype, it turned out dual targeting was what really they needed in this particular case.